sports injuries? What are sports injuries?
Sporting injuries are injuries that can occur in both recreational and competitive sports and exercise and can happen to anyone.
What causes sports injuries?
Sporting injuries are caused by a poor understanding of the warm-up, exercising or play and warm-down cycle, which is very important to prepare and prevent us from having injuries.
What are the symptoms of sports injuries?
The cardinal symptoms of a sporting injury, like any other injury, includes swelling, pain, and restriction of motion of the particular body part which is injured.
How to reduce the risks of sports injuries?
We have to understand our body. We have to start slow and build up. We have to understand the rules of playing and also exercise and not get overwhelmed and competitive from the word go. The appropriate attire and technique is of utmost importance.
What is the first step in responding to sports injuries?
The first thing that we need to do when we seemingly get injured is to stop the sport or exercise that has caused the injury. The concept of no pain, no gain is sometimes unsafe when we are injured. The RISE protocol is often used in acute injury. It involves R, which is resting the part, I, ice, which is cryotherapy, cooling the injured part, compression, that means putting a bit of compression and pressure on the injured part, and elevation of the injured part to reduce swelling.
How is sports injury diagnosed and treated?
The most important thing for me is the history. That means the story which the patient gives of how this injury occurred. It gives an indication of the severity of the injury and the part that is probably injured. Following that, a thorough but gentle examination of the injured part is done, and this often gives us 95% of the diagnosis of what possibly the injury can be. As we move on further, the appropriate investigation is done, whether it's an X-ray, an MRI or an ultrasound. Not every sporting injury needs to be imaged. Most of them can be diagnosed with a good history and a proper evaluation. Appropriate care and diagnosis hold hand in hand for proper recovery.